was overweight, severely overweight, 400 pounds. Just needed a life change.
In the past, I've tried pretty much every weight loss program that's out there, from Jenny Craig to Nutrisystem, Weight Watchers, you name it. I've usually, when I'm on those, I'll lose a few pounds and then I would just level off and that would be it. So,
I had a balloon put in.
Yeah, non-surgical. And how much weight did you lose, Terry?
Right now it's 80 pounds.
And how much weight did you lose?
roughly 35 pounds.
Fantastic.
Yeah. Wasn't quite sure what to expect when I first had it done, but very pleased.
But after about a month, my body got regulated to the balloon being in there, and because I chose healthier foods, I obviously started losing weight, and as the weight came off, I felt better and better about myself, to where it was easier just to choose the healthy foods over the not so healthy. And now it's just like a complete 360 of how I look at food.
It makes you feel full sooner, so your portions are obviously much smaller.
Did you find yourself eating a little healthier?
Absolutely.
And because I had invested in other types of diets, I said, I'll do this my end and you do your other thing and we'll see what happens. Well, I'm still not to where I want to be. So I saw her when she went to, she was going to a wedding, and she had a nice outfit on, and I was like, whoa, I got to do this. I don't care how much it costs, I got to do this. So I went to her house and said, tell me what to do. What do I got to do?
And I would recommend this to anybody.
So continuing with our March Makeover Madness, we're now tackling bad eating habits, and we're getting some help from Orbera Medical Spa and a new procedure. So we've got Doctors Charles Moak and Carl Pesta with us. Thank you so much for being here.
Thank you.
So let's talk about the device and the procedure. Explain that to us, Dr. Pesta.
Basically, it's a device that we place endoscopically. So it's a sedation procedure, as if you're having your colonoscopy or an upper endoscopy, or even just a minor procedure. So we provide sedation, and then basically what we do is, while the patient is sedated, we do an endoscope. We look down into the patient's stomach, and we look around, make sure everything's safe for placement.
Make sure the coast is clear.
Exactly.
Yes, absolutely.
Exactly. Make sure the coast is clear. We start with a deflated product. Once it's down, so it starts like this. It starts out here.
That's what it looks like when it goes in?
Exactly.
Oh
Goes
my
down the mouth. But you're
gosh.
sleeping, so don't worry.
Yeah,
about
okay.
it.
Yeah.
You won't ever see it. So we start with this down. It goes down into the stomach. Once it's in place, we then inflate it, and then this sits inside the stomach.
Okay.
So even though it was just FDA cleared in the United States 6 months ago, it's been around the world for over 20 years. Over 250,000 of these procedures done before.
This is just where the work begins, because this is like an opportunity. Most people are getting this done, have gone through a few weight loss things before, just didn't work. They kind of fall back in their old habits. So the balloon being in makes them feel full, and makes them feel full earlier, so they can eat less. Now we can work on changing the entire habit process, okay? So we were eating like a normal American, which makes us gain weight. And now we got to realize we got to be a little bit like, really food crazy people. We got to eat like really good food. Walk to the grocery store. We know we're supposed to shop on the outside. And we're having our patients do that. It really works effectively to get adequate nutrition. It's kind of drop the idea of the American diet about eating a bunch of meat and grains and potatoes, and eating more high density, nutritional density vegetables.
So we've got a patient that said she tried everything from fad diets to weight loss pills and nothing worked. So we've got a before picture, and then she did the whole 6 months, right? And then look at that after. That's amazing.
And look at how she feels too.
You could see it.
Yeah, you could see it.
You could see it. So this is 4 months after receiving the device, and she lost how many pounds? 23?
Yeah, 23 pounds. Yep.
Okay.
Yep. And all through non-surgery, so no incision, very minimal downtime, if any.